it's interesting. I can't remember who. I remember reading in the paper. I don't remember who said it, so I apologize for not being able to quote the person and give them credit for it. But she said, in certain ways, living in places like the Midwest, it's harder than it is in the South, where some of the racism is just flat out overt, and you can tell by a sign that's sitting in a person's yard, or a bumper sticker on a car or anything like that. Living here, it's not as common that you would see something like that. So you don't know. You could be having a great conversation with somebody and not really know how they truly feel about you and think less of you, or it's interesting that got brought up. I had never really thought of it that way.
That is interesting. Because if you see a red sign, you can say, I'm going to go this way.
Clearly it's not a welcoming house for me, right.
If you see something visually, you know how to take a different path, that it's important for self-protection, where when you walk into a classroom with a teacher who has some extreme implicit bias, and you're forced to, it's an expectation, especially kids, that's a loss of power, but on top of everything else.
And again, are they short with that child? So you think about when schools talk about disparities in the amount of detentions that were given out, the amount of suspensions that happened, the grades, things like that all play into, I before I even get to know this person, as soon as they walked in the door, I already made up my mind about them, and this is what I think, and they're not a good person. So how do you think you're going to treat that kid the rest of the school year that they're in your class, or that subset of your classroom?
Is that like the cradle to prison pipeline, and constantly a target for...
Yeah, and it's the same with policing, right?
It is.
If in your mind you've been taught, or somewhere you picked up that African Americans are violent in nature, they're aggressive, how does that impact your policing? So when you have an interaction with them, are you quick to use force as opposed to not? What does that look like? I mean, it's implicit biases. I mean, it jumps into so many different things that can impact your decision making if you're not aware that that it's there and that you have it, and how it's showing in your behavior. Yeah, I know. I just got done talking to Mayor Gallagher up in Bettendorf, and we had a good conversation about just what are some of the requirements that police officers have to go through. Physical, written, psychological was one of them, and the trainings that they go through. And depending on the police department, I mean, it's pretty intense. But that's the struggle is every police department's a little bit different, so they have different set of guidelines and requirements. So I think today President Trump signed an executive order to look at having national standards across the board for police departments, which we'll see how that turns out.
One step at a time. It's that easy. What can elected officials do to improve equality?
I think it's listening to your constituents when they raise concerns, no matter if it's one person or 1,000 people that's bringing up an issue. You were put in that position and elected to serve the community and to listen and to help impact change in the community. So I think that's one of the most important things, if not the most important thing that an elected official can do, is to sit down and listen to everyone that has a concern in your community, especially at the local level. Obviously, in state and federal level, it's a little bit harder to listen to every single person that reaches out to you. But understanding and having a pulse on where members of your community are is the most important job of an elected official.
And I would think that's a difficult job. It's a difficult job to listen to the voice of people that you're representing, but that's in essence what that position is that they have elected to be in. So super important. Anything else in regards to elected officials or for the general community in partnership with elected officials that we can take action.
Yeah, so I think as a community member, understanding that you have a voice and your voice should be heard. And if it's not heard, where can you go to make sure that it is heard?
Right.
And that is at your city council meetings. And, you know, some of these public meetings that anyone in the community can go to and express their concern, their thoughts, or feelings about any topic. Understanding that you have that outlet as a citizen in your community to do that is important. But then also, what steps can you take if you don't see change? You have the power to vote. You have the power to run for office.
Yes.
You know, and affect change that way. So those are two additional steps you can take to make sure that you see the change that you want to see in your community. I think at times we hesitate to take action because we think, oh, yeah, there's so much, which there is in the world of diversity and equity inclusion. There's so much work that can be done that it can cause inaction.
Right.
But you can really just start small. If it is a podcast where you start listening and gaining some understanding or looking up the definitions of what these words mean, that's action.
That is action.
Yeah, and take some time, and it, you know, it doesn't happen overnight. Knowledge is never gained overnight in that way to where you feel competent in understanding the material, but or the situation as it impacts people in our community. But starting one step at a time is helpful.
I love that.
In spurring action.
Yes,
yeah.
I love that because it can be overwhelming. To say, well, I need to go out and speak to legislators. I need to speak to... No, you can take that individual small action.
Yep.
I appreciate that perspective and that step back because sometimes so many opportunities can create, as you said, inaction. And we don't want that. The podcasts are a simple way. There's documentaries, there's books, you know, kind of diving. As I said, when I say you have to understand, individually do the work, that's exactly, and that's where it needs to start. Yeah,
self-reflection. And then if it is grabbing a cup of coffee with someone that has a different viewpoint than you and open up the conversation. And work your way up to talking to elected officials.
Right. Or go with a friend who's comfortable doing it.
You can just jump right into it if you feel that passionate about it as well. But if you are feeling that sense of, you know, how do I even get started? Just start small.
Yeah, start small.
One step at a time.
And that's one of the things that I think it can be, people have brought this to my attention, is I will say let's just go talk about it. Just go, you know, address it. Let's talk about it. Let's have a conversation. And that's not easy for everyone. That can feel a little intimidating to go in front of a city council. So I would encourage hearts and minds, if it feels too scary to go alone, go together. There are others who also want to give voice to a specific situation. For this specifically, talking about improving equality within our policy practices in our city, in our county, go with a group of people. There are other like-minded people with lived experience, people who want to be a voice. So find your group of individuals and go to those meetings together. Because it can be scary individually. I'm always scared to speak. But I know it's a calling within me, or much greater than me, to give voice to, I call myself an unapologetic advocate in life. I think I've shared that with you before. And so I find the ability to do it and use my voice, but it doesn't mean that I'm not scared every time I do it. I just take the energy to push me forward.
And also understanding, Christy, that, you know, when you're doing that, I'm sure there may be others in the audience that have the same thoughts and feelings that may be a little bit more timid in raising that concern. And the fact that you're doing that shows that there is concern out there for that specific topic or issue. And if that doesn't happen, if you don't speak up, how do those folks that can affect change, the elected officials, how do they know that that's a concern in their community if it's never brought up?
Right.
And we're sitting there
They don't
complaining
know.
about it as
Yes.
community
Yes.
members, but nobody is raising the issue to the level of the people that can implement that change.
Right. I say that in leadership all the time. I want to be the best leader that our team needs for me to be, and for that our community needs. So if I'm doing something that isn't right, or it could be better, I'm not going to know unless somebody shares that with me. And I always open that door and welcome it. So what can corporations do to make an effective impact in the workplace? And when I say corporations, this could be small businesses, large businesses. You've led a lot of work in our healthcare business. So what are some things folks can do for employees, for customers, for community impact?
Yeah. First, I think, the first step is just understanding kind of the role that you can play. And how can my business, how can my church, how can my organization be a part of making change happen in our community in a positive way? UnityPoint Health, through the American Hospital Association, signed a pledge that we would help fight and end healthcare disparities in our organization. So looking at the data that we have, the experiences that patients have and when they come through our doors, and being able to track that information and then allow that to help us move forward towards change is one way that we've looked at ourselves and said there is a place for us to make a difference. And we've made a commitment to do that. So that's one example for us as a healthcare system. But for any business, any nonprofit, it's finding out what is it that we do, and again looking at that process and that flow, and is it open and welcoming to all the people that we can serve in our community, and if not, let's take some action steps to address that.
What would be the best way to do that? Because I'm thinking, my visual in my head is we've got senior leaders sitting around the table, or executives, or church council people, or you've got the leaders of an organization sitting together going, okay, so how does this read? What does this look like? Do we have everything we need? Is that the best action, or who else could be a part of those conversations to look at policy, to look at what stances we have, the voices of people with lived experience? Yeah,
so I think that's where the importance of diversifying your boards and your committees, your councils is extremely important, because you do get that different perspective, that different viewpoint from not just one person, but multiple individuals. Don't just assign one person and go to that one person as the subject expert, but get a group of people together. My experiences in the Quad Cities of Muscatine is different than someone else who's grown up in the area. And so having both of us at the table would make a lot of sense, because I may bring some things up that person doesn't, and vice versa. So not just having one voice at the table, but having a number of different viewpoints, and then raising the question or the idea up in that setting. Not having a conversation offline about, I think this is a good to do, and that type of thing. But as a leadership team, as a council, bringing up the conversation around disparities and inequities in our community and in our organization, and addressing it in an open forum, I think is helpful.
Thank you for that insight. I think the collective view and collective feedback is vital. I know that's something in public health which we seek to do in the work we deliver in community. If we're going to create some new literature or tools or resource for education, we've created it before, and we've taken it to the people that we're going to be serving and say, what do you think of this? Tell us what your thoughts are. Does this make sense? Because sometimes we start speaking our own public health language in it that may not make sense to somebody else. So really that's understanding everybody at the table's perspective, and inviting others' input and perspective to the table as well. So Thank you for that. Very, very important. So let's talk a little bit about diving into the health inequality specific in Iowa. What are some examples current state that may be occurring in regards to some health inequalities?
Yeah. So I think, recent pandemic, COVID-19 has shown just the vulnerability of communities, of population groups in our community, specifically underserved community members, have really struggled through COVID. And some of the numbers that we've seen in Muscatine and in the Quad Cities have disproportionately impacted communities of color. When we talk about amongst our communities, 84-85% being Caucasian, but those that have tested positive for COVID in our communities are 43% communities of color. You're seeing the impact of those healthcare disparities in real time. And I think a large part of that is due to what we've talked about before in social determinants of health. When you look at the housing situation that people live in, transportation, employment, and the exposure that certain jobs bring when you have a pandemic and you can't afford to take off time or from work or work from home like some of us have the luxury of doing, but you have to show up and go to work.
Right.
And then you're surrounded by people that could potentially be carriers. So housing, jobs, transportation, again, all of those things contribute to the disparities that we've been seeing in the Quad Cities so far.
Yeah, and it's very it's difficult that this has had COVID has had an impact on everybody, right? But it's disproportionate.
Yeah, and then you also look at in the African American and Hispanic community specifically. We know there's a higher prevalence of diabetes and heart disease.
Right.
And you also know if you contract COVID and you have comorbidities, you're at higher risk of having major complications as a result of that. Similar to if you caught pneumonia or the flu, it's harder to recover if your immune system is already compromised. So that's the other piece, fortunately, and I think it's important. The work that our healthcare systems have done here locally in taking care for people, that we haven't seen huge death rates amongst those in these specific communities, but you've seen it in other places like Chicago, where you have a high death rate because people have those comorbidities in addition to contracting COVID.
And one of the things, when you talk about what industry does an individual work in, we encourage folks, if you're in high-risk populations, stay home. However, that may not be an option, as you said, based off of what your career is or what your work you're doing.
Yeah. And one of the other things we started looking at too is, how are people getting information? Do you have the luxury of hopping on the internet and Googling what the CDC's recommendations for this? How is the communication getting shared in those specific communities? Is it culturally relevant by way of translated into a different language that fits your need as a community member, so you can take those measured steps to protect yourself?
Right. And so mindfulness, the CDC does have some great resources, but again, access to broadband, internet, but they have many things in many different languages and ASL, and they do some mindfulness in their marketing pieces.
Yeah. So it's important for us as healthcare providers and looking at population health in the way that we do is to identify some of those challenges that some of our community members may experience, and how do we then address those challenges and shift our focus to meet the need.
Right.
So we don't see those rates continue.
Yeah, we definitely want to. Right now in Muscatine County, we're at a low. We've really reduced, and now we flattened our curve, and we hope that it continues to remain in that space. So ending our time today, first I want to deeply thank you for your time and commitment. Daniel drove from the Quad Cities to come down and meet with us today. He cares about public health because that's what he's been doing, right? He's been in the space of public health. And our Muscatine County area and being a leader for our county. So I thank you for your time. I honor you for who you are as the beautiful human that you are.
Thank you.
I have a call to action to our county, Daniel, and it's really is making, after everything that we touched on today and that you shared, is making a commitment to learn and understand. Mm-hmm. There's many ways that we can do that. You can have conversations with a friend, and people of color ask questions, but first ask permission if it's okay to have these conversations together, because as I heard from a wise person is that their heart was feeling encouraged, but they're also feeling exhausted for being a voice for many, but it is important. The conversations matter. Mm-hmm. Listen to different podcasts. There's a lot of podcasts out there. Sawbones is one of them. They've really promoted a lot of information around healthcare in particular, and about implicit bias in healthcare and how people are treated differently in the healthcare system. How I just listened to a recent one, and it was really interesting how Black Panthers, in a time and space that were maybe seen as aggressive or rebellious, really opened up the doors to public health and health equity. I learned something new. I love learning new stuff, I tell you. So, review your personal and professional bias. Mm-hmm. You can Google what you might need to just Google and start with what does implicit bias mean? Yeah. What does that mean? What do aggressions and microaggressions mean? What the heck is Christy talking about? What are these conversations? They keep bringing these terms up. This is something that's innate in Daniel and I's work that we do, probably both personally and professionally in our communities. So check that information out and understand. I know there's little quizzes out there to understand your implicit bias and what work do you have to do as an individual to recognize and move through that. We will also connect you with there's other books and other resources that we will make sure that we get out to everybody for that continued self-education. But really, ultimately, thank you for tuning in today. Thank you for being a part of this and leading this important conversation for the Muscatine County communities. We appreciate you. I appreciate you so much, Daniel.
Thank you. Yes. And thank you again for having me today.
Yes. Thank you. See you next week. Bye-bye.